Thanks for coming, guys. I know it's hard to get here right after work at 6 o'clock, but we're going to go ahead and get started. Like Danny said, I actually have worked at the Val Verde office for a little over 3 years. We opened about 3.5 years ago, and I do have 3 children. My youngest is about 3 months old. I've just been back to work now for about a month, so I relived some of this not too long ago, which made it a little easier to write the presentation because I was thinking about all of these things anyway. So to get started, this is the hardest, but actually probably the most fun thing you'll ever do, and I love it. So it is very rewarding, but it's challenging, and we're going to talk about some of those challenges and just common questions and concerns that we have and what to expect when you start this journey with your child. The first thing is, are you ready? What do we need to do to get ready? And that's very nerve-wracking, I think, when it's your first baby. Do I have everything ready? That nesting that you go through. So most people, I think, anymore will sign up for some classes just like you're here tonight with me. Those birthing classes like Lamaze and breastfeeding classes and hospital tours. So all of those things are good to help sort of prepare you for what lies ahead. It's kind of nice to know what to expect before you actually go through it. One thing I always mention to parents when they come and meet me before they have their baby is check and make sure the hospital you're delivering at has a neonatal intensive care unit. As pediatricians, we feel that's really important. And the reason being is that if your baby were to have trouble right after it was born, they will have some staff, either physicians or nurse practitioners, generally from the NICU, that could come and be there just within a minute or two of the baby's birth to help take care of it if it was having troubles breathing or anything like that. Most of the hospitals in the Omaha Metro do have a neonatal intensive care unit. Methodist across the street here does, but there are a couple that don't. So we would just recommend that as you're looking around. And then we do have a lot of parents come and meet with us before they have their babies. We like that because then we kind of get to meet you and know you before we see you in the hospital when you're tired and all these things are going on. It gives us a chance to sit down and talk in a little bit calmer environment and get your questions answered ahead of time. A couple things you want to ask about if you do go to meet with a pediatrician ahead of time is what are their hours? How do they handle things after hours? What's their procedure for contacting a doctor or a nurse if you have questions when the office is closed? Make sure they're covered on your insurance plan. And we would recommend that you pick a pediatrician who's board certified. That would mean that they've passed their pediatric boards that are given by the American Academy of Pediatrics. You do not have to be board certified to practice medicine. So just because the doctor's in the phone book doesn't mean they're necessarily board certified. But all of our children's physicians are. So if you picked someone with children's, you would automatically be picking someone who's board certified. And then what do we need to buy? What do we need to register for our shower? That's really important. You want to get a crib, of course, and you want to make sure you have a firm mattress. And that's because we know that a firmer mattress helps decrease the risk of SIDS. When you're going to get your crib stuff, I'll tell you that buying crib bedding is a waste of money. That's just a marketing ploy to make you think your baby room is cute because you really can't use any of it with the baby. You can't put the bumpers in your crib anymore, and those big quilts they sell to match, you can't use either. So put the money in the college account that you were going to spend on the bedding. Car seat obviously is very important. Most people buy those little baby carrier car seats that fit in the base, and those are really nice when you have a newborn. And then a lot of times those will come with a stroller, or you're probably going to want a stroller at some point. Other things that I think as a mom are really nice to have would be a good baby monitor. The vibrating bouncy seats are lifesavers. And then you want to make sure you have supplies to feed the baby. So bottles, if you're going to breastfeed, you might want to look into a breast pump. Although I will say that breast pumps are quite expensive. And if you're not sure if you're going to be breastfeeding or you want to just try it first, you can rent breast pumps from most hospitals for about $50 a month. So some moms prefer that route because they can get a really good hospital-grade breast pump to try and see how things go before they spend their own money on a $300 breast pump. And those are actually sometimes covered by insurance depending on what's going on with the baby and how it's feeding. We can sometimes get those covered. And what I would like to say is that what I have learned as a mom is that the most expensive things are not always the best. So we got this really fancy high chair when we had my first child, and it had 6 height adjustments and it reclined. I don't know why you would need to recline when you're eating, but it did. And I hated that high chair because in all those little holes where you could adjust the height, food got stuck and it was really disgusting and it was hard to clean. So I gave the fancy high chair to Goodwill, and I bought a really cheap high chair that doesn't have any height adjustments, and it's really easy to clean. So don't think that you have to, buy the fanciest thing. It's not necessarily the best. The potty chairs that play songs when you go on them, I wouldn't spend your money on those either. And then what should we bring to the hospital? So when you're trying to get all your suitcases ready before the big day, what do you need to pack? So obviously clothes for mom and dad. One thing for mom, I think, is it's nice to have a pair of pajamas or a nursing bra because hospital gowns are not comfortable. And when you have visitors coming, it's nice to have something that's maybe a little more modest than a hospital gown, or to have a bathrobe to put over it. So mom, think about yourself when you're packing on things that you might want to wear after you have the baby. Your regular clothes aren't going to fit quite yet, so you're going to want some comfy clothes with elastic waist and nice, modest nursing pajamas or something like that. And an outfit for the baby to go home. They usually take the baby's picture at the hospital, so you might want to have something cute that you want their picture in before you go home. And I found it really helpful to take a nursing pillow with me. I didn't have that the first time, and hospital pillows are not comfortable and difficult to arrange properly when you're trying to breastfeed the baby. So if you're thinking you're going to breastfeed, it's probably a good investment. They're about $25. And then, of course, video camera, your laptop. If mom's going to be in labor for a long time and maybe dad is bored, it'll give him something to do. Cell phone to call family that's out of town. And then your car seat you're going to need. Most hospitals will kind of want to see your car seat, actually. If you get a new car seat, that's great. But if you're getting one from a friend or family member, or if you have an old one, you want to make sure and check that it's not expired. I didn't even know they expired until I had my last baby, but actually they have an expiration date stamped in the plastic. So if you get one from someone, make sure it's not an old expired car seat. So when it's time, when you have those signs of labor, or if you're scheduled to go in and be induced or have a C-section, they will go ahead and admit you to the hospital. And when they do, they'll ask who the pediatrician is going to be. And they will have you fill that out on your paperwork. And then once the baby comes, they will call us. If the baby's born during the day, they call our office. And if the baby's born at night or in the middle of the night, they'll call us by our pager the next morning. And so we will come and see you within the first 12 to 24 hours after the baby's born. And it just kind of depends when he or she decides to come. If it's at midnight or something, we'll see you the next morning before we go to the office. So then after that first visit, we're going to come and see the baby every day that you're in the hospital and check him or her over. We do kind of a head-to-toe exam, look for any issues or problems that we think the baby might have. And then we're going to spend some time with you every day asking how feeding's going, what questions you might have, talk about any concerns we might have with the baby. And the day you go home, there's a little bit of discharge instructions that we'll be giving you when we want to see you in the office, worrisome signs to watch for, normal things to expect, how to take care of the umbilical cord. And some of that I'm going to be talking about a little later on in this talk. So you'll see us a couple times at least while you're in the hospital. When the baby actually comes, what are you going to expect when he or she makes his appearance? So generally, your obstetrician is going to be there, and then also a couple nurses to assist with taking care of the baby. Generally, we are not there at that time because that's fairly unpredictable for us. We'd have to be running all over Omaha all day to try to be with all those babies. So we do have the nurses at the hospital there that are assessing them immediately after they're born. And most of the time, we're trying to get that baby to take that first breath. So we're going to stimulate them. And for dads watching especially, you might think, gosh, that nurse is really drying off that baby pretty vigorously. But that's actually what we want, because that helps stimulate that baby to take a breath. And they're going to suction out their mouth and nose, try to get any amniotic fluid or mucus out of there. And then they're going to assign what we call APGAR scores, which are just a quick assessment of how we think the baby's doing. And we do that at 1 minute and 5 minutes. And usually that'll be one of the nurses that's taking care of the baby. And so you get 2 points for 5 different categories. You get heart rate, respirations, color, muscle tone, and then how they react to stimulus from an outside source. So If you have a high heart rate over 100, you'll get 2 points. If it's under 100, you'll get 1 point. And if you don't have a heart rate, you would get 0 points. So the maximum score you can get is 10. Most babies are going to get an 8 or a 9 most of the time, and they'll do that at 1 and 5 minutes. That really, it means something at that time and in that time shortly after birth, but it doesn't necessarily mean anything when you bring the baby in at 6 months and tell me that the APGAR score was 7 at 1 minute. So it's something that we use right in the beginning. And if they tell us the baby has low APGARs, that makes us think maybe something's going on. But if they have good APGARs, then that's fine, and we're not going to really talk about those anymore. And there's a few things they're going to do right away to your baby right after it's born. They're going to put ointment in its eyes, and that's to help prevent a couple different types of infections that can be passed from mom to baby through the birth canal. They're going to give them a shot of vitamin K, and that helps prevent what we call hemorrhagic disease, which is bleeding that newborns can sometimes have because they don't have good clotting of their blood. And so sometimes one of our questions when we take tests in pediatrics will be, this baby was born at home and now it comes in, it has all these bruises. That's because they didn't get their vitamin K. So they'll be giving that shot right away in their leg. And then now we do recommend a hepatitis B vaccine right after birth. And the hospital that you go to will probably ask you about that as you're getting checked in. And we would recommend that. That's part of a series of shots that we do for hepatitis B. And so we do the first one in the hospital after they're born, and then 2 more subsequently down the road when you come back for your well baby visits. So those things will happen pretty quickly after the baby's born. And so then once the baby's there and you've had time to cuddle and call everyone and tell everyone the news, what do you need to do? So the nurses are really going to help you, as well as the pediatrician that comes to see you. But we do like to keep track of how much they eat and how much they pee and poop. And we like them to poop and pee within that first 24 hours after they're born. That's kind of our deadline. So the nurses will be watching for that, and we'll be asking you to tell them and make sure that they have that recorded, that the baby's had urine and stool. And then we just want you to rest. And this is, probably the neatest time is those few hours after birth is just a really wonderful time. So we want you to enjoy that, bond with your baby, hold your baby. If you're breastfeeding, we want you to try to breastfeed there within about that first hour. Most babies are really awake and alert after they're born, and that's a really good time to try breastfeeding. After that, they tend to get a little sleepy. So later on, after delivery, a few hours later, it's going to be harder to get them to wake up and nurse. So take advantage of that first hour or so. And one piece of advice is try not to let family and friends overwhelm you, especially if it's your first baby. Everybody's really excited to come up and see them. So one thing I might say is call Grandpa and Grandma right away, but maybe save your other phone calls for a few hours later so that you guys can rest and enjoy the baby before you get inundated with everyone you know coming to visit. Big question, and a lot of things we talk about with parents are, what should we feed our baby? And that's really a personal choice. That's up to you. And I have moms that do both, and we're going to support you whatever choice that you make. There are some benefits of breast milk that we'll go over and talk about, but there's pros and cons to both. And for some women, it works really well, and some it doesn't. And we don't want you to beat yourself up about it if it doesn't. But we think any breast milk the baby gets is better than none, so it's probably worth at least a try. Whichever you choose, I tell parents that first 24 hours, I call them dazed and confused. They're kind of sleepy and tired, and they're worn out from being born. And so you're not going to get a baby to eat every 2 or 3 hours for that first day after they're born. You're only going to get them to eat a couple times probably, and that's normal. So don't stress out if that baby's not waking up to eat like you've read in the books, because they're not supposed to yet. But after that, when they're a couple days old, you're going to plan to feed them every 2 to 3 hours. And you're going to look for signs of hunger. So one thing you're going to do in the hospital is if the baby starts to wake up and be alert or have that rooting reflex, which is turning their head to the side and kind of making that sucking motion with their mouth, that's a great time to try to feed them before they get really upset and screaming mad and hungry. So you want to kind of look for that when they're first starting to stir and wake up is a good time to try to feed them. So advantages of breast milk, it's natural and it's obviously cheaper, it's free. So that's helpful. And we know that in the first 3 days, you don't have a lot of breast milk, but what you do have is a little bit of breast milk called colostrum. And that's really important because it has a lot of antibodies in it, which are important for your baby's health. And you also get some fatty acids in there. And it can be a really special time with your baby. A lot of moms really enjoy that bonding process that they have with their baby. When you're at the hospital, you're going to hopefully see a lactation specialist. Most of the hospitals in Omaha are going to have a lactation specialist come and visit with you while you're staying there. And so they'll try to help you get the baby latched on properly and answer any questions you might have about breastfeeding. And then we're also there to help too when we come by in the morning and make our rounds to talk to you about how it's going and when we see you back in the office. And one thing that we're seeing more of now, which is really exciting, is that we've have more opportunities and more places to send moms after you leave the hospital. If you're still having trouble, we have lactation people that you can go back and visit as an outpatient and work on breastfeeding with them. So that's really helpful too and a good resource for you if you're having trouble. Formula, a lot of moms like because they know exactly how much their baby's getting. That's one frustrating part for some people about breastfeeding, is that I don't know how much they just ate. I don't know if I should feed them again or not. And I think the formulas now are a lot better than they were 20 years ago. They've tried to make them as close to breast milk as possible. So they've added things like these fatty acids, which we know are important for your brain and eyes for those type of development, and also what we call probiotics, which are good bacteria. And those are found in breast milk and we think promote a healthy intestinal tract. And so they've started adding those too. So I think formulas are a lot more high tech than they used to be. And the nice thing is then other people can help feed the baby. It doesn't always have to be mom every single time. And if you are interested in formula feeding, you can talk to your pediatrician about what kind of formula they would recommend. There's a few sort of main brands that we talk about, and we'll try to help you pick the right one. So when you feed, with breastfeeding, we are calling it feed on demand. And usually for most breastfed babies, that's going to be about every 2 to 3 hours. Sometimes it's more often than that. Sometimes it's every hour. And a lot of babies do what we call cluster feeding in the evening. So in those evening hours, sometimes it'll feel like all you have is that baby attached to your breast for 4 hours straight. And that's kind of normal, but not necessarily a bad thing, because sometimes if they can feed a lot, then they'll sleep a little better at night. As far as formula, I always tell parents not to let them go more than 4 hours without feeding, at least in the beginning. So you're going to wake them up and try to feed them if it's been more than 4 hours. And for most babies, we base how much milk they need on their weight. So for an average baby that weighs about 7 pounds, you're going to need about 14 to 16 ounces a day to have good weight gain. Now that part is not true in the first 2 or 3 days after delivery. Those first couple days after delivery, most babies don't take very much. They all lose weight. We expect that, and that's normal. With breastfed babies, your milk takes about 3 days to come in. And so they're getting that colostrum from you, but they're not getting a lot of calories. And so we do watch that weight. But some of these rules about amounts are going to apply more as the baby gets a few days older. If you do bottle feed, we want you to get a slow flow nipple and look for a bottle that's BPA free. That's kind of the hot new topic, is the plastics and that BPA. And I think most of the bottles I've seen now say on the label that they're BPA free. So that's good. They have lots of different kinds of bottles out there, and parents always ask me which type is the best. And again, I will say that the most expensive type is not always better. In the NICU, when we have our little preemies, when we feed them, we just use regular old-fashioned Gerber bottles and nipples, and they're pretty plain Jane, but most of the babies do well with those. I've had some babies with those fancier bottle systems that have a hard time latching onto those great big giant nipples. So sometimes it's a little bit of trial and error, but don't think you have to spend, $20 on a bottle, because that's not necessarily true. When you're in the hospital, there's a few things that we're going to do to your baby that are kind of standard practice besides those shots I talked about. We're going to do a hearing screen on the baby. And the way they do that is they actually have, they measure the emissions from the ear when they play a sound that is measuring the nerve that conducts the hearing. So they're actually measuring a nerve response for hearing. And that's a screen, and they'll check both ears, and if the baby fails, they'll probably try to repeat the screen once when you're there. If the baby's active, fussy, it's not a good test, so they like to do it when the baby's quiet. A lot of times they'll do that at night, maybe when you've sent the baby to the nursery for a little while. They'll also take blood for what we call a newborn screen, and that's required by the state of Nebraska. That has to be drawn after the baby's 24 hours old, so you wouldn't be able to leave the hospital until after the baby's 24 hours old and they have their newborn screen drawn. And that checks for several inherited or metabolic diseases. And metabolic diseases are problems with the way your body handles protein, fat, or carbohydrates. And those are really important because if you don't detect those and a baby would have one, they can require a special diet. And if you don't know that and they're not on that special diet, it can lead to some serious problems. We also check for things on our Nebraska screen like sickle cell anemia, thyroid problems, something called PKU, which is a metabolic disease. Cystic fibrosis was just added in the last couple of years. Every state is a little bit different, but those are some of the ones on the Nebraska screen. And that's just a heel poke, so it's not a big deal, but the lab will come and do that. If you have a boy and want him circumcised, that would also happen while you're in the hospital. And then we're always going to be assessing how much the baby weighs, and we worry about too much weight loss. So with that breastfeeding and knowing your breast milk's not in, we want to make sure the baby doesn't lose more than 10% of their birth weight. And so they'll weigh the baby every day while you're there, and we'll be interested in seeing what that is. And then we'll also be checking the baby for jaundice, which I'm going to talk about a little more on another slide. If you decide to have the baby circumcised, there's a few things we'd like to tell you about that. There's a little bit of evidence that maybe there are some health benefits. It prevents, we think it decreases the risk of penile cancer, but that's a very rare cancer anyway, so not usually a big reason to circumcise in and of itself. We do think sometimes a little bit less chance of urinary tract or bladder infections if you're circumcised versus uncircumcised. For some people, it's a religious custom. Your pediatrician or your obstetrician would be the one performing that, and that would happen sometime while the baby's there. We usually like to wait and make sure they've peed once to make sure all the plumbing's working properly before we go ahead and do the circumcision. And then we like them to pee again after to make sure it's still working properly after we did it. So those things will happen sometime while you're there. It pretty much is more dependent on when the physician that's performing it has time. So whenever they have time during morning rounds or if they come back later in the day, that would be a time that they would do it. And usually they use a little bit of local anesthesia, so they're going to numb up your baby with a shot similar to Novocaine like you get at the dentist. And a lot of hospitals will give them a little dose of Tylenol after for some pain relief. When you go home with the baby and they've been circumcised, the nurses will talk to you about what you need to do to take care of that until it heals. So usually we say Vaseline with every diaper change to kind of put on that area. It's going to be a little bit raw and sore, and that'll help prevent the diaper from rubbing on it and irritating it. It's going to heal, and about 3 days after you have the circumcision, it's going to look really ugly, and you're going to say, oh my gosh, why did we do this? But that's normal. It's going to look like it's kind of got a yellow scab or film on it, and that's what we want to happen. And if you do need to clean it, if you get some stool on that area, you don't want to wipe it with baby wipes because then you're going to disturb that little scab that's formed and healing. So you're just going to take a washcloth and get it really wet and kind of wring it on over the penis there and kind of rinse off any stuff that's on there that you need to clean off. As far as jaundice, that was what we were talking about in an earlier slide. That's very common and one of the most common things we see in newborns. It's caused by increased levels of bilirubin, and that's a chemical or a compound we find in our red blood cells. And so as our red blood cells are broken open and they die, it releases this pigment called bilirubin. And that happens to all of us, but usually our liver is very good at handling that and getting rid of it in our urine and stool. But babies don't have a very mature liver, and it's not very good at handling bilirubin. So we tend to see an elevation when the babies are about 2 or 3 days old. That can be worsened if you're breastfeeding, if your milk isn't in, the baby's not nursing good, not peeing and pooping well. That can cause the bilirubin level to go up because we know that the bilirubin comes out in your urine and stool. And there can be actually some problems that can cause even a higher increase. If mom has a negative blood type and baby has a positive blood type, that can cause increased jaundice. Or if mom is an O blood type and baby is an A or a B, those are what we call blood type incompatibilities and can cause increased jaundice in the baby because mom is actually making antibodies to the baby's blood cells. So we are looking for all of that, whether you know it or not. We're looking at that from mom's chart and baby's chart, and we're assessing for those things. And I think all the hospitals here do a really good job of staying on top of that and making sure that we are watching babies for that. So how we check for that is we do either a transcutaneous level, which is where we have a little machine that just shines a light on their forehead, and that will give us a number, or a blood test. Now, with the transcutaneous, we found that's not as accurate as the blood test. So a lot of times we'll get that to start, and if it seems a little high, we'll follow it up with a blood test because that's really the result we believe the most. It's normal to have some elevation, as I said, and usually it's at the highest when they're about 4 days old. DOL stands for Day of Life 4. And then it should go down. We get concerned if the level's close to 20. And we also interpret that in terms of how old the baby is. So if you're only 30 hours old and your level's already 18, and we know it's going to keep going up till you're about 4 days old, we would be really concerned. If you're 5 days old and your level's 13, we know it's probably already going down, so then we're not as worried. So that's something that most babies are going to get checked for. So when is it time to go home? For most vaginal deliveries, you're going to stay about 2 days, and that's pretty much dictated by insurance. They think most moms should be able to handle going home after 2 days, whether we think so or not. C-section, 3 to 4 days. So depending on what kind of delivery you have, you might see us 2 times, you might see us 3 times, and if you have a C-section and are having a little trouble and you end up staying 4 days, then you might see us 4 times. After you go home, we'll sometimes set up what we call home health visits, which is where a nurse comes to your house and they'll bring a baby scale and sometimes weigh the baby at home if we have concerns about that, or recheck the baby's bilirubin level for jaundice if we have concerns about that. Now, what do you do when you get home? That's a big day too. Once that baby's finally in your house, what do you do with it? So when you're nursing or feeding the baby every 2 to 3 hours, you learn how to get by on very little sleep, but you do need to try to sleep when the baby sleeps. And all the books say that, but it's a lot harder to do, I think, in real life because people call and want to come visit. People are bringing flowers, people are bringing supper, the neighbors are coming over, somebody needs to walk the dog. So really for mom, you really do need to take a step back and really try to take care of yourself, because if you don't, the sleep deprivation is going to catch up with you when the baby's, about a week old, and you're just going to really have a hard time. So forget about the laundry. Don't worry if the dishes aren't done or the house is messy. If you have to eat pizza or Chinese every night for a week, it's fine. If grandma or somebody's going to come and stay and help, let her clean and cook and do laundry, and you rest. For mom, especially if you're nursing, remember to drink plenty of fluids and to eat. Sometimes you're not always going to feel that hungry, but try to eat, small amounts if you're not feeling well. And just try to take care of yourself. And dad really has to step up too and help with some of those things that mom usually does so she can rest. When do you go back to see us after you go home? So we really try to bring all our babies in just a day or two after you go home from the hospital. And part of that is because of that jaundice issue. We know that's right about when that bilirubin level is going to be at its peak. And so we want to see the baby and kind of assess that. Because if you have a vaginal delivery, sometimes you're going to go home when that baby's only 36 hours old. If you have them in the evening on a Tuesday and you go home on a Thursday morning, baby's really not going to be that old yet. And we also like to assess the weight. Like I said, most mom's breast milk comes in on day 3 or 4, so babies are going to lose weight until that time. And we want to make sure they don't lose too much weight, and that if you're having breastfeeding trouble, we can help address that right away. And if we need to do a little bit of supplementing, that we can tell you how to do that properly. So most of us are bringing our babies in just a day or two after you go home. And then after that, if everything looks good, you're going to come back when the baby's 2 weeks old. And that's our first, what we call healthcare maintenance visit. So that's going to be another head to toe exam on your baby. And we like them, if they've lost weight, to get back to their birth weight by the time they're 2 weeks old. So that's kind of one of our benchmarks that we're looking at when you come in. And we're also going to review those results of that newborn screen they took in the hospital, because the state is going to forward those to our office. So we're going to make sure that we talk about those with you. And usually I find that by the time the baby's 2 weeks old, you've gotten a little bit of experience and you have more questions maybe than you did at that very first visit. Questions about feeding, questions about pooping, questions about bathing. So we have a little bit of time to talk about all of those things. And then after that 2-week visit, if everything looks good and baby's doing well and mom's questions are answered, then we'll see you back when the baby's 2 months old, and that would be their next well baby check. And that would also be the first set of shots. Now at our office, when we talk about shots, at every well baby visit where they get shots, I'm always going to go over what vaccines we're giving and why, and what to expect after if you're going to have any reactions. And we try to review all those things with you. So if you have questions about vaccines, that's a good time to ask those for your pediatrician. So I'm going to talk a little bit about pooping and peeing. Babies are really good at this. There's a reason they make 96 diapers to a package in those newborn diapers, because you're going to go through them quickly. Those initial stools after birth are called meconium, and they're these black, tarry, sticky stools. They're very difficult to clean. And those are usually going to happen for the first couple of days, and then we're going to have what we call transitional stools. As the baby starts to eat more, the poop's going to start to change, and it'll gradually turn to this mustardy yellow soft color. It'll look like it has little seeds in it, and that's normal. Usually they're going to pee anywhere from 4 to 10 times a day. And for pooping, most formula-fed babies are going to poop 1 or 2 times a day, or sometimes even skip a day, which is fine. Breastfed babies, usually in the beginning, they're going to poop almost every time they eat, so 8 or 10 times a day. But sometimes as they get a little bit older, they'll kind of go the other way and only poop once a week, which is really frustrating and alarming to parents. They save it all up for one big one, but that can be normal too. Just make sure grandma or someone else is over when that day's coming so they can change that diaper. When should you give the baby a bath? 2 or 3 times a week is probably good. You want to make sure your water's not too hot, and we recommend that you set your water heater to 120 because we know that higher temperatures than that can scald the skin after just a couple seconds of exposure. When we went to do that on our water heater, I thought there was just some dial you turned, but the water heater we had at the time, actually, I just had to turn the water on as hot as it would go, stick a thermometer in, see what I got, go turn down the valve on the water heater and keep doing it until I got the right temperature. So you might want to check into that before the baby comes and see where you're at. When the umbilical cord is on, we like you to do sponge baths. We don't like that cord to get wet. We know that it's harder for it to fall off if it gets wet, and a little bit increased chance of infection. So try to avoid that area when you're bathing your baby. We just want to keep it clean and dry, and we want to watch for signs of infection, which would be redness in the skin around the belly button, any kind of yucky discharge, yellow, green, brown type discharge, or a stinky smell. Those things we would want you to call us about, because occasionally those can get infected. And those little baby fingernails are really, really difficult. So if you have trouble trimming them with the little clippers, just use an emery board or a nail file and kind of file them down. They're really kind of paper thin and sometimes hard to get off. And sometimes you'll just see one kind of hanging by a thread and you can kind of pull it off. And one thing we'll go over with you multiple times, I think my patients, the parents feel sometimes like I'm a broken record, but these are really important things that we want you to look for and call us right away. If they would ever get a fever in a little baby, we consider that emergency, and that would be 100.4 rectally. That correlates to 38 degrees Celsius. That's why we picked that number. In a baby, I really only consider a rectal temperature to be accurate. So under the arm doesn't help me, in the ear doesn't help me, on the forehead doesn't help me. So if you think your baby's feeling hot, you need to check the temperature rectally, and you're just going to use your basic digital thermometer. You're going to use a little Vaseline or something for lubricant, and you're only going to put it in until you can't see that metal tip anymore. And most thermometers are going to read in about 30 to 45 seconds. And don't worry, I know a lot of parents are afraid they're going to hurt the baby, but you're really not. You're barely putting it in there. But that's a core temperature, and that's the temperature we believe. So that's the one we really want you to check. And I always tell parents, don't go home and check their temperature every day, because you're going to go crazy if you do that. Only check it if you think they're feeling hot or if they have one of these other signs, okay? In the hospital, they're going to do your baby's temperature a few times when it's born, and they will do some of those under the arm. And the reason they're doing them under the arm is they're just kind of doing a general assessment. They're not really looking for fever, but if they ever get one under the arm that's suspicious or a little high, they're going to check it rectally to confirm it anyway. If you think the baby's getting a lot more yellow and it's not the day to go back to your pediatrician, we would want you to call us. They start looking like a pumpkin. If they're not waking up to feed after about 3 hours, that can be concerning, that maybe something is wrong, that they're getting sick. Projectile vomiting, I think at some point everybody probably has an episode of projectile vomiting, but this would be every time you feed, everything you feed just comes right back up and shoots across the room. We would want to know about that. If the soft spot on top of their head is bulging out, that's a worrisome thing we'd want to know about. Or if they're what we call inconsolable, so they are just crying and crying and crying and crying, and you've fed them, you've changed them, they're warm, everything you can think of you've done, and you can't get them to stop crying, we would want to hear about that too. We'd probably want to look at them. And one thing I always say, especially at this time of year, if you're going to have a baby in the next couple months, we've got that flu out there now, so you really need to make sure that you are screening your visitors. So sometimes you kind of have to be mean and say, well, if you've had a cold, sorry, you can't come over and see the baby, because not everybody has to come see the baby the first 3 days of their life. And little kids especially are germy, so if you have nieces and nephews, friends that have toddlers, I would try to discourage them from visiting or keep them in a different room. And get lots of hand sanitizer. Make sure everybody cleans their hands or washes their hands before they hold the baby. Don't feel like you're being a pain by doing that, because you're just trying to keep your baby healthy. So don't feel like, don't let people act annoyed if you tell them to clean their hands. Just happily offer and make them do it. All babies have times where they cry, and one thing we see a lot of patients for is, my baby's fussy and I don't know why. Can you check their ears? Why are they crying all the time? So you're going to figure out to some extent what your baby's cries are. You're going to know the hungry cry. You're going to know the pain cry. You're going to know the I'm wet all of a sudden and I don't like it cry. Sometimes they're just lonely and they want to be held and snuggled and they're tired of laying there alone. So these are things, different causes we've listed here. This MSPI is one I have on a later slide that I'll talk about, as well as reflux. But one thing that I think we don't realize, and I didn't realize till I was in medical school and then until I was pregnant myself, is that when babies are inside mom, they're not swimming around in the uterus with lots of room. That's a really tight muscle that's around them, and it holds them and kind of swaddles them really tightly. It's dark, it's warm, they can hear mom's heartbeat. And that's a great place to be. So when they get out into this big cold world, they do not like it. And so you are sort of wanting to recreate the womb for them a little bit when they're fussy, because that's really where they want to be. So swaddling them up tight. When you're in the hospital, the nurses are going to swaddle that baby and they're going to wrap it up like a little burrito. And they love that. Sometimes we'll just quiet them just by doing that. So there's this book called The Happiest Baby on the Block, and they have diagrams in there of how to wrap them in those receiving blankets, so you'll swaddle them up real tight. Also, kind of laying them on their side, we know seems to, for whatever reason, kind of recreate that environment, and they like to be on their side. Swinging or swaying with them. Again, this is recreating the womb, because when mom's walking around all day when she's pregnant, she's kind of automatically swaying that baby. So a lot of moms will learn that kind of side-to-side swaying helps calm the baby. And the shushing sound, just the shh, 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 they like that too. And then sucking either on their hand or a pacifier sometimes. Sucking is not only to eat, but also for calming and comfort. So a lot of times giving them something to suck on will help. So those 5 S's are things to try and remember when you're calming a fussy baby. And don't let grandma tell you that you're going to spoil the baby if you hold it a lot in the first 3 months, or if you pick it up every time it cries, because babies actually need to be picked up when they're crying in those first 3 months. They need to know that someone's responding to their needs and wants, and it's not really the time to let them cry it out. So you can't spoil them. And if anything, I think hold them as much as you can, because pretty soon they're going to be a toddler and they're not going to want you to hold them. So you have to enjoy it while you can. So don't let grandma tell you that you have to let them cry it out or let them cry themselves to sleep. That comes later when they're older, but not when you have a newborn. Spit happens. So we'll talk about spitting a little bit. We have sort of 2 categories of spitters. We have what we call happy spitters. And those are babies that gain weight really well, that burp well, but every time they eat, some of it comes back up. And so we know that sometimes they just have a little bit of floppy muscle tone in their stomach and esophagus, and especially if they get a little overfull, some of that just kind of comes back up. So we want you to try really hard not to overfeed them. If you find that they spit after 3 ounces, maybe cut it back to 2.5 and see what happens. And you want to make sure that you do get good burps out of them, because sometimes if you get an air bubble sort of trapped and you have some milk on top of that, whatever's on top of that air bubble when it comes up is going to come up with it. And keeping them upright after you feed them for about 20 minutes is going to help gravity just let that milk get through their tummy, and less will come up. You can also elevate the head of their bed when they're in a crib or bassinet by putting something under the mattress, not under the baby, but under the mattress, to kind of make it more of a 30-degree angle, and that'll help decrease spitting too. So happy spitters, that's something they're going to outgrow, and you just kind of have to deal with it, get a lot of bibs, and just pack a lot in your changes of clothes in your diaper bag, and as long as they're gaining weight, well, we're probably not going to do anything about it. Worrisome symptoms would be, again, that projectile vomiting that shoots across the room. If they spit up bile, I always tell parents if it looks green like pea soup, you need to call us right away. Blood can be worrisome, although if you're breastfeeding and your nipples are cracked and bleeding, sometimes babies will actually swallow some of mom's blood from nursing and spit that up, and so that can be a little bit scary for mom. But if it's just a little bit of streaky blood, we usually don't get as concerned about that if mom has a history of sore, cracked nipples. We do get worried if they're spitting up and they're not gaining weight. So if we think not enough is staying down, we're going to investigate why that is. Some babies get what we call acid reflux symptoms, so they get really kind of a heartburn feeling, just like grown-ups do. And they can be really fussy, get stiff, arch their back, scream inconsolably. And those things we can treat sometimes with antacid medicine, just like we do in grown-ups. Some babies will just refuse to eat. They'll act hungry, but then you give them the bottle and they just turn away and spit it out. And if you ever have breathing problems, babies that are spitting up and then choking, turning blue, obviously we would want to know about that. That can mean that something more serious is going on. This is something I mentioned in an earlier slide, MSPI, which is called milk soy protein intolerance. And that's a problem that babies have with a protein in the milk or soy that causes inflammation and irritation in the lining of their intestine. And there's a few different symptoms we can see with MSPI. We can see really frequent stools, like 20 or more in a day, where they're pooping every single hour. You can see blood or mucus in their stool, or just an extremely fussy baby that we've not been able to figure out the cause. We sometimes think of this. So what happens if we diagnose that, and one of the ways we do is if they have blood or mucus in their stool, it's most likely this MSPI. There's not a lot of other things that can cause that in a newborn. We need to give them a type of milk that does not have milk or soy protein in it. So if you're formula feeding, we would do one of these formulas that's what we call hypoallergenic. So it's been, the milk and soy proteins have been washed out of there. Or if mom is breastfeeding, there's a diet you can do. And actually, if you Google it, you'll be able to find some websites about it where she's going to completely avoid all milk and soy protein in her diet, which is pretty challenging. I've had moms do it, but it's a tough one. No dairy. Most processed foods that we eat have either milk or soy proteins in them, bread, crackers, things like that. So you have to get pretty creative. Milk chocolate, not allowed. So yeah, it's a tough diet, but I've had moms do it and babies do well. If they do have MSPI and we do make one of these switches, we have to let the intestines heal after they've been irritated. So you usually aren't going to get a magic cure after the first time you feed them with this different formula or the first day after mom changes her diet. It's going to take 2 or 3 weeks for that intestine to heal and for the fussiness and the blood in the stool and the frequent pooping to go away. So it's a frustrating problem. I think some parents really get at their wits' end because the baby can be so fussy. But we'll help you and try to help you hang in there and work with you, try to make sure that your baby keeps gaining weight and that we get something that everybody can tolerate. The good news is usually they're going to outgrow this. A lot of babies outgrow it even before they're a year old. So sometimes when you come in at your 6 or 9 month well check, we'll say, oh, if everybody's doing good, maybe we'll try a little milk-based formula or have mom start adding a little bit of milk or soy back into her diet and see what happens. And the majority of them do outgrow it by 1 year of age, so it's not something you have to deal with for the rest of your life. Sleeping. So that's another thing we like to talk about with newborns. And on the next slide, we'll talk about back to sleep and SIDS. But again, when you think about the baby inside mom, baby's pretty much sleeping all day when mom's up moving around at work, taking care of other kids or whatever she's doing. That swaying motion is going to lull the baby to sleep. And then at night when mom's resting, what's that baby doing? It's kicking and moving around. And guess what? When the baby's born, it doesn't know that things are supposed to be the other way around. So they always have their days and nights mixed up. And that's going to take some time. There's no magic way to fix that the first week of life. But what you can do to try to start the process and help the baby learn that nighttime's for sleeping and daytime's for being awake is when you're up at night, try to make those nighttime feedings really brief and dark and quiet. With my first one, of course, no one told me this and I didn't know it. So my mom was there, and when he got up, she turned all the lights on, the dog was up, it was a party. And it took forever to get that child to sleep through the night. But I learned, I wised up with the other two, and we didn't have anyone else over, and the dog had wised up by that time too, and he didn't even open his eye and look at me. So it does get better, and usually by about 4 months of age, I'd say the majority of babies are sleeping through the night. But try to keep, things quiet, things dark. Turn on the TV on mute, maybe just for a little bit of light, or just get a little lamp that you can turn on. Don't turn on all the lights and make a lot of noise, because then you're just going to precipitate that baby thinking that it's supposed to be up all night. And during the day, when you're feeding the baby, try to make things more exciting and stimulating. So more light, more noise, more people around. Now, even if you do this in the beginning, they're still going to sleep through it, but it will work over time. And like it says here, around 3 to 4 months of age, it's going to get better. As far as colic, that's crying for more than 3 hours a day for more than 3 weeks straight. And that too is going to resolve around 3 or 4 months of age. It usually starts when the baby's about 4 to 6 weeks old. The question for us is always, is it really colic or is something else going on? So is it a refluxy baby? Is it an MSPI baby? Is there anything else to explain this? And sometimes we don't always know, so maybe we'll say, well, it sounds like some of the symptoms could be reflux. Why don't we try and see what happens if we treat that? Does the baby get better or not? They've done a lot of studies on colic. They did one study where they took a bunch of colicky babies, and some of them they drove them around in the car. Some of them they ran the vacuum cleaner. Some of them they put them on top of the dryer. Some of them they gave gas drops. They tried all different things, and nothing worked consistently. So, and even in the same baby, what works for mom and dad one day to fix their fussiness and get them to calm down doesn't always work the next day. So some of it is just time and being patient and taking turns. If the baby's been crying for 3 hours, one of you leave and go walk around the block and then give the other one a break, so that you don't get too overwhelmed and stressed by this crying baby. Now we're going to talk a little bit about SIDS, and that's the sudden infant death syndrome, which is the sudden unexplained death of an infant that's less than a year of age. That is one of our leading causes of death in babies between 1 month and 1 year of age. The SIDS rate kind of peaks when the babies are between 2 and 4 months old. And so that's the time we like to talk about making sure that you follow all these guidelines that I'm going to list on this next slide. They'll make you watch a video in the hospital about back to sleep. So that was our campaign we did about 10, 15 years ago, that instead of sleeping on their tummy like they used to, we found that we decreased our risk of SIDS just by putting babies on their back. And the other thing, again, is that you're going to want to avoid all that stuff that's in the Pottery Barn catalog, the crib bedding, the bumpers. You're just going to have the baby with a sheet and the mattress. You're not going to have toys in there. You're not going to have bumpers in there. You're not even really going to have a blanket in there. What's nice to have your baby in if it's cold is one of those sleep sacks or just really warm, fleecy pajamas, rather than a blanket. Should keep them warm enough. Now, we know that babies who are in homes where people smoke have a higher risk of SIDS. And that's just not people that smoke in their house, but people who are smokers in general. So even if you smoke, but you do it outside, there's still some secondhand exposure from your clothes. So I think our wish as pediatricians is that none of our parents would smoke, because we know that can lead to different health problems. So if you can try to avoid that, that would be great. We also have some new information that pacifiers help decrease the risk of SIDS, and you don't even have to keep it in all night. You just have to fall asleep with it for a nap or bedtime. So in the beginning, if you're breastfeeding, we don't want you to use a pacifier right away, because we want you to breastfeed on demand. And if the baby's acting like they want to suck on something, then they should be nursing. But once you have a good milk supply, the baby's gaining weight good, and they're a couple weeks old, it's okay to start introducing a pacifier and try to give them that when they're going off to sleep. We know that if the baby gets too hot, that can maybe contribute to SIDS. So again, all those blankets and things piling up on them is not a good idea. We think that not having good air circulation around their face can contribute to that. And so we've also found in studies that having a fan going in their room helps, either a ceiling fan or just a little fan that you put on the table or on the floor will help prevent that. And then obviously we have the baby monitors. Some of the baby monitors now are pretty fancy, even have a little TV screen on them, so that you can hear if your baby's making noise or anything like that. And then tummy time helps, we know, because it helps the baby get stronger back and neck muscles, which is going to help them learn how to roll over. And the risk of SIDS is really going to start to go down once your baby can roll over back and forth. Once your baby is really good at rolling over, they're probably going to roll over and sleep on their tummy when they're about 5 or 6 months old. And I tell parents that's okay. I mean, you can't stand in their room all night and keep flipping them back over, or you'll never get any sleep. But once they do that, you really don't have to worry so much about SIDS anymore when they're good rollers. So babies make all these weird movements that kind of freak parents out sometimes. And there's some normal reflexes, we call it. One is called the moral or startle reflex, and that's where their arms and legs will come out and be kind of stiff, and they'll startle to a loud noise, or sometimes when we're examining them, if our hands are cold. Also that rooting reflex when they're kind of looking for something to eat, turning their head to the side, sucking reflex, grasping reflex, which is where you push on their palm or in the middle of the sole of their foot, they'll kind of grasp like a little monkey. Stepping, which is where if you just hold them up, they'll kind of step with their feet like they're trying to walk if you put their feet on the mattress or the floor. And then fencing is the pose that they'll do where they'll actually put one arm out to the side like that. So these are just normal baby reflexes that we kind of check for when we're looking at them. It's normal for their eyes to cross. They don't focus very well for a couple months, so don't let that alarm you if they're looking at you cross-eyed. It's okay. And because they have an immature nervous system, they make a lot of jerky movements and erratic movements. Things aren't coordinated very well yet, so that's okay. We get worried if one side's moving but the other one isn't, and that sometimes happens after delivery. If you've had a big baby and a little mom, they can get what we call a nerve palsy on one side, which usually resolves. If they have rhythmic movements, so arms and legs jerking, we think more about seizures, and that would be something we would want you to tell us about. That's just not one arm or leg jerking one time. That's repeated rhythmic movements. And then if you have a baby that's really, really stiff or really, really floppy, like a rag doll, that's a muscle tone issue. So we would want to know about that too. This is other things babies do to drive their parents crazy. So some of these are things that I would say first-time parents, I see most babies for one of these problems in their first month or two of life. Sneezing is normal and very common, and so is hiccuping. Again, that's kind of part of an immature nervous system. A lot of babies get mattery eyes, and that's because their tear ducts are very small and get clogged easily, and then the tears cannot drain down into their nose like they're supposed to, so they get backed up and matter in their eyes. And if that happens, we teach you how to massage their tear duct with your pinky finger and try to keep those tear ducts open. And generally, a majority of babies are going to outgrow that as they get older. Fingernails, like I said on the other slide, get long, hard to cut, but you can file them. Sometimes they'll get white patches in their mouth, which can just be milk or formula stuck on, but sometimes can be a yeast infection in their mouth, which we call thrush, and is easy to treat with some medicine. And then my favorite one is they breathe funny like Darth Vader. So almost always I'll have a mom come in and say, they're just all rattly, they sound congested, I think they have a cold. And mostly what that is that babies tend to always breathe through their nose if they're able. But their nose is really little, and it doesn't take very much mucus to clog it up. And so when that happens, since they can't blow their nose, they just get really rattly, snorty sounding, and they sound like they have a bunch of phlegm up there. And they really probably don't have a bunch. They probably just have a little bit, but they can't clear it out. So they're going to give you one of those booger suckers at the hospital, and that's a good thing to use. They'll kind of show you how to do it. Because remember, you probably blow your nose every couple days, and babies need to have their nose blown for them too. But funny, rattly breathing usually is not a scary thing for us, so that's okay. A couple newborn rashes we'll talk about quick. There's one called erythema toxicum, which is that very top square. It's not a great picture of it, but that's a rash we see usually when the baby's about a day old or so, usually still in the hospital. And it looks like little bug bites, almost little pimples with kind of a red circle around the little bitten looking area. They call it a flea bitten rash. We don't really know what causes it, but we know that it's doesn't harm the baby, it's not contagious, and you don't have to treat it. It's going to go away on its own after a few days. Baby acne is very common, and probably not so much right after they're born, but when they're a couple weeks old. And we think that's partly from hormones that they get from mom. Some of our hormones that are still in their system can cause some little pimples and things, and that'll, again, get better as they get a little bit older. If you're breastfeeding, sometimes they're still getting a little bit more hormones from you, so it might last a little longer. Milia are these tiny little white dots on their nose, that up-close picture of the nose there. And again, that's nothing we have to do anything about, and they'll outgrow it. And then cradle cap, this bottom picture of a head, that's kind of a worst case, which is, again, we think probably hormone related, and we can recommend a couple things for you to try to help get rid of that. And then diaper rashes. A lot of diaper rashes that we see right after your baby's born, especially if they're a baby who poops a lot, sometimes can just be from the poop having a lot of acid in it. If they're jaundice, that bile, that bilirubin comes out as what we call a bile acid, and it's really kind of hard on the little baby bottom. So we want to make sure that we use a good thick diaper ointment. There's several that you can use, A&D or Desitin, Balmex, but something thick to kind of be a barrier for that baby's skin against that kind of acidic poop, and that'll help. And then sometimes they can get a yeast diaper rash, so a yeast infection, and that takes a special prescription cream to treat, but usually we can get that cleared up too. So I think we're close to the end here. Just a couple final thoughts. I know for me, even though I was in the middle of residency when I had my first baby, I got a lot of advice from friends and family, from my mom in particular, and she would say, well, when you were a baby, I put you on your tummy to sleep, and when you were a baby, you rode in the front seat of the car. Just because we did it when we were little doesn't mean that it's the best way. We were lucky that we lived through that, I guess. So take that with a grain of salt and say, okay, thanks for the advice, but do what you feel you need to do for your baby. And if something seems really wacky that someone's telling you, you can always ask us what we think. And remember, what works for one baby doesn't always work for the next. So if your sister tells you, well, this worked for my baby, you can certainly try it. But even between siblings, what works for one baby doesn't always work for the next. And I always tell parents, don't be afraid to call us with questions. There's no silly questions. And for me, as the baby's doctor, I'd much rather have you call and check on something and be able to tell you that's fine, that's normal, than not have you call and have it be something that was really kind of a big deal. So the moms will always say, I feel like I call you all the time. I feel like I'm here all the time. And I always say, it's fine, it's fine. Don't worry about it, because we would rather help you and make sure that you understand what's normal, what's not normal. Because, babies don't come with directions, and they do silly things sometimes. We'd like to help you figure that out. And remember to take time for you and dad. You still need some grown-up time, so maybe not right away when the baby's a month or two old. Go out to dinner for a couple hours and leave them with grandma. She'll be glad she gets the baby all to herself, and you'll be glad you got to go have a nice dinner together. If you have other children, don't forget them. They're going to have a little bit of adjustment period. Those 18-month or 15-month to 3-year-olds are going to have a rough time. They might regress in their behavior. If they're potty trained, they might start wetting their pants. More temper tantrums, things like that. It's just going to take a month or two for everybody to get used to this new person in your house. And so try to make some special time with the other siblings. Do something just with one of them while dad or someone else watches the baby for an hour, so that they know they're still special too. And of course, never shake a baby. They'll have you watch videos about that. But remember that nobody ever was harmed from crying for 10 minutes. So if you're at the point where you just think you're not going to be able to handle it, put the baby in the crib where it's not going to get hurt, and just leave, go outside, take a couple minutes. Your baby's going to be okay laying in there crying for a couple minutes, and we want you to have time to cool off too. And then cherish these moments, because it goes fast, and kindergarten will be there before you know it. So even though someone told me once that the days are long, but the weeks and months go quickly. So those long days that you think are never going to end, pretty soon it's been 2 years and you don't even know how you got there. So have fun. And now I'll take questions if anybody has them.
You were saying that when the kids are younger, to let them cry, don't let them cry, hold them because they want to be in the room, right? When does that stop? Because I have kids that are 6 months old. I'm kind of taking this class to kind of learn some new things, but my kids are 6 months old now. So how could the grandma just come in and say, "Don't hold them, like you're cuddling them too much," and like I don't get to see them as much as the mom does. So all I want to do is hold them because I don't get to see them as much.
Well, what I always tell my families is that I'm never going to tell you to do something that I couldn't do with my kids. So I was never good at letting them cry it out, because if they're crying, I'm going to be awake anyway. But I think the point of that is, a little baby can't manipulate you. Now, a 6 or a 9-month-old, if they're getting up at night and they're crying, and then the minute you walk in their room, they stop, they're maybe, just wanting to see mom or dad, and there's really nothing wrong. So then you kind of have to work on, okay, well, I'm going to maybe let you cry for 5 minutes and see what happens. Or maybe I'm just going to go in and rub your back for a minute, but I'm not going to pick you up and hold you, because I know that you're really okay because you stop crying the minute I walk in the room. So I think it's a little bit of, and some babies are more demanding than others, but, I think you have to enjoy that time too. And if you know that your 6 or 7 month old is fed and changed and not cold and they're just kind of fussy, it's okay to leave them there for a couple minutes and see if they can work it out themselves. But if they're screaming for 10 minutes, I know that I couldn't let them lay there and scream for longer. So, yeah.
Keeps crying, and I know he knows that I'll pick him up
Yeah.
because it's like, well, Dad will pick me up. So,
Yeah.
yeah.
So, and you kind of can sort of try to wean them off of that by maybe instead of I'm going to pick them up, I'm just going to go in the room and comfort them. Yeah.
Bad father is what I guess I'm getting at.
Yeah. Now when the 2-year-old comes in your bed at 3 a.m, that's a little bit more manipulative than the 6-month-old. So it changes the older they get, what the advice that we give you. What other questions do you guys have? It doesn't so much have an effect on breastfeeding. It's just the concern of jaundice. So if mom has, like I said, a negative blood type and baby's a positive blood type, we can see a little bit increased risk of jaundice. And sometimes those babies that have jaundice for blood type incompatibility can have a little bit worse jaundice and require a little bit more aggressive treatment and be jaundiced for a little longer. So we kind of watch those babies a little extra close if we know they have that issue. Anybody else?
Is there a certain size or a certain age where you could give the baby a blanket?
Well, I think that, I think they have to be quite a bit older. So you're looking at probably 9, 12 months before you're going to get stuff in the crib. Yeah.
Does the size have anything to do with it, or is more of the age?
Size of the baby? Not really. It's more age.
Would it be best to just wait till they're a year old?
Yeah, I have the crib bedding that we bought with the first one, and for this last one, I didn't even get it out of the box because what's the point? I think we used the quilt that came with it as something to play on the floor. We didn't even put it in the bed.
I don't want to have the baby people walk in and be like, "Why don't you have a blanket on your child?"
Well, that's why they have, actually at some of the hospitals, they'll even give you a sleep sack as one of your gifts. And those are really nice because they are kind of fleecy and warmer, but they're not going to get, the worry is with a blanket that as the baby moves, it's going to get twisted up and be by the face and interfere with the airflow by their face. So we know those sleep sacks and those warm jammies aren't going to get up by their face and cause trouble with their breathing. Anybody else? Oh, there we go.
The breathable bumpers. They have new bumpers out now that are breathable. Can you still use those when they're newborn?
Well, technically when they're a newborn, they're not really moving around that much. Now, one thing I had in the notes, but I forgot to say was I have found personally that having the baby in a bassinet those first couple months of life is actually probably a better bet for a couple reasons. I think they sleep better in a bassinet because it's a smaller space. Again, they feel more like they're kind of swaddled and enclosed if they're in a little bed versus a great big crib. And then you can have that right next to your bed so that when you're feeding them every 2 or 3 hours, they're right there by you. You don't have to traipse across your house to go to their rooms. So by the time you get to the point where you have them in a crib, they're usually a couple months old, and then the bumper issue, you're probably not going to want to get it on there. So, but I've found that with my kids and then my friends and patients that have babies, the bassinet trick works really well when they're little. I think they start to sleep a lot better in that smaller area. So that's one good investment, I think, is a bassinet. Or some people use their pack and play, but something that's a little bit smaller space for the baby to sleep in.
Are there certain bottle nipples that work better if you're breastfeeding and pumping, like going back and forth?
The lactation people like the Nook nipples in UK. That's one of the ones that they've recommended for people that are switching back and forth. It's supposed to be more similar to a breast. But again, I've had babies do fine on just regular old nipples too. So I think you kind of have to experiment a little bit and see what works best for your baby, which one they like. Anybody else? One thing do you have one?
Is there any concern with the temperature of your house? Like, I'm gonna have a baby in January. Like, we're probably gonna have a heat up. Is it too hot, too cold?
Well, you just kind of want to keep it at a temperature that's comfortable for you. So don't feel like you have to crank up the heat because the baby's there, okay? Because you're going to have the baby in probably some kind of a onesie and then a jammy. So they're going to have a little bit more layer on than you are. So just your normal house temperature is going to be fine. Don't feel like the thermostat has to be on 80 because you have a baby. Because actually we think, again, that the hotter temperature is actually a little bit worse for the baby. So that more 70 to 75 range is probably a better temperature range for your house.
For babies that like to be swaddled, how do you deal with that, putting them to sleep? If, like, can you put them to sleep swaddled? Or
They actually make these swaddler things that are just from kind of the neck down, and they sort of Velcro. You can find them at any of the baby stores, and so they still hold them tight, but they're not, stuff isn't up by their face. Because when they swaddle them in the hospital, it kind of is a little bit. The blankets are kind of all up there, and that's generally okay because pretty much someone's always with them in the hospital, and we're not really seeing that SIDS in a 2-day-old. But if you do want to swaddle them at home, I'd recommend getting something like that. One other thing I wanted to mention that I didn't really say on the slides, but I've had just personally a lot more questions from parents about vaccines, and that's not really what this talk is about, but just for my own little personal soapbox, I want to tell you all that I would really encourage you to talk with your pediatrician if you have questions about vaccines. I used to get, when I started, which was only 5 years ago, I'd get maybe one question a week or one question every 2 weeks, and now I get questions every single day about safety of vaccines, and is this really okay, and should I give all these vaccines at once? And again, I always tell parents, I'm never going to have you do anything to your child that I wouldn't do to mine, and we definitely support vaccinating your baby. We, as pediatricians, have seen kids die of these vaccine preventable illnesses, and you know, I would never want that to happen to one of my patients, but it's definitely out there. It's in the media. It's on the internet, it's in all the parents' minds, and we really feel they're safe, and we feel we have good studies that show that. But if you have questions, we'd really encourage you to address that with your doctor ahead of time, so that when you come in for those well baby visits, that you kind of have a plan in place, so you can do the right thing for your baby and do what, you know, everybody is comfortable with. So that's just kind of a little extra thing I wanted to throw in there, because that's a big part of that first year of life is well visits and vaccines, and we want to make sure that we're promoting health for your baby. Any other questions?
Do you recommend interviewing pediatricians before the baby's born? And if so, like, what's the kind of, how do you do about
How do you do it?
Yeah.
Yeah, I think a lot of parents do it, and I know as a pediatrician I like it because then I get to meet them ahead of time, and that way when the hospital calls me and says you have this new baby, I can remember that, oh yeah, I met that family, and you know, they were going to have a baby boy or whatever. And you just call the office and you just tell them that you're an expectant mom, and for our office we call that a get to know you visit, and there would be no charge for that, and they would just set up a time for you to come in and talk with one of us and give you some information about our office. So it's easy to do, and I think pretty much everyone in town would do that.
At what point do you do the get to know you?
You know, I've had moms do it when they were just maybe 4 or 5 months pregnant, and I have had moms do it the week before they delivered. So it's really up to you. Whenever you have time and it's convenient for you, we'd be happy to see you at any time. All right. Looks like all our questions were answered. So was there one more? But no? Okay. Well, thanks for coming, guys. It was really nice to have you all here, and I hope this was helpful. I think they wanted you to drop some stuff out up front with an evaluation, and good luck to all of you with your children.